Hi guys, it's Sabrina. So today I'm going to be talking about my last 2 weeks of inpatient burst. A lot of you guys have been asking me questions about my schedule, and I can make a video specifically on kind of what we're doing with our clinicals. What we're doing is called Longitudinal Integrated Clerkship, so I'll let you guys know a little bit more about it and why we've only been doing like these random like bursts and weeks. We were kind of just thrown in the hospital for the first 6 weeks of our clinicals to see what it was like. And we spent 1 to 2 weeks on each specialty, and that's kind of what they wanted us to do, to like get used to it for the first 6 weeks and see what it was like. So next week I'm actually starting some outpatient clinic stuff, so I'm excited about that. But anyway, so these past 2 weeks I've been doing internal medicine. The first week was just internal medicine, and then the second week was a specialty of internal medicine called Infectious Disease, and that was a really cool specialty. So for internal medicine, you kind of have like a 7 to 4, 7 to 5 schedule. I think the residents have like a 7 to 7 schedule. They're really busy. You show up in the morning, you go see your patients, you either go follow up on a patient you saw yesterday and see how they're doing, and kind of update your presentation, or you get assigned a new patient, you go see this new patient, you take a full-on history of this new patient, you try to figure out what is going on, and then you present that new patient. So that's kind of what we did on internal medicine. I did get to go ahead and interview a patient on my own fully, which was really cool to be able to practice interviewing a patient for the first time. That's not standardized, so that was really awesome, and getting to talk to them and just being on my own was really cool. So I did that, performing a physical exam and just trying it out for the first time on your own. It was interesting to have your own patient to follow up on, talk to, get to know better, and you develop really close relationships with your patients because you are seeing them almost every day for a whole week. So it was really cool. I really enjoyed that. I liked the continuity of care a lot, which was something I was definitely missing. So I did enjoy internal medicine because of that. So our day would start with us going to see a patient or following up on an old patient. Then we'd have rounds in the morning, anywhere from 9:30 to 11. And rounds would be quite a few hours. It could be anywhere from 2 to 4 hours. They were really long for internal medicine, which was really different compared to surgery, where their rounds were 1 hour tops. I don't think we ever had a longer rounds. And you do round with your attending also, which I didn't do in surgery. So your attending is there the whole time. You present to the attending. They give you feedback, or they ask you questions. I did get pimped a lot on internal medicine. I think it was actually the most from all the other specialties. I present a patient, and let's say they had heart failure, then I'd get asked what type of drugs should it be on for their heart failure, and what are the side effects, and I'd be asked how do you classify heart failure and stuff like that. So I'd have to be ready and really study up on my patient before I'd present, to make sure that I knew what kind of questions I might be asked and stuff. So it was actually really helpful, because I know this is how you can prepare for your shelf exams, and step 2 is by getting to know your patients really well and studying up on them. And apparently you do really well on your exams if you take good care in learning about your patients. So I did try to take advantage of that and learn that. I also just learned a lot on internal medicine, because when you do get asked questions, you tend to remember the ones you forget also, so that's really helpful. And we had didactics, so we had lessons with the attending. She'd like to teach us different topics after rounding, which was really cool. I really enjoyed that. For internal medicine, they kind of have different days. They have call days, which is from 7 to 7, and you see a specific amount of patients. They total can only see 20 patients, so if they already have 15 patients from the day before, they can only see 5 new consults. And then the next day I think is post-call, and they have different names, post-call, pre-call, I don't know. They have tons of names for different days. I was kind of confused. I just did what the resident told me to do and showed up when I was told to show up. And that was internal medicine, so lots of seeing patients, lots of discussion of treatments and what we think is going on. Definitely a mystery that we have to solve, which was really cool for each patient. Most of the patients though, sadly, if they are in the hospital, they're not doing well, so that was kind of rough for me to have to see patients that weren't doing well. It was different from outpatient, where you get to sit down with your patient, you've been following him around for years and years, you guys are really good friends, he's doing pretty well overall. It was different to be inpatient in the hospital and to see the sickest of the sickest people, so that was definitely hard on me. I don't think I like inpatient as much because of that. I think I like outpatient more because I'm talking to people that are generally healthy and well and not dying on me. So, you know, it was a depressing time in the hospital, definitely these past 2 weeks. Yeah, and I ended up working 6 out of the 7 days for internal medicine, so it was really busy. Then we did infectious disease the next week, and it was kind of the same schedule, 8 to like 5, 7 or so. We'd go in the morning and they'd have something called morning report, where they have an attending or a resident kind of teach you a topic, which was really cool. So we learned a lot. Like I had topics on acute pancreatitis, we had topics on stopping like heparin or warfarin before colonoscopies and like different things like that. So it was really cool. I got to learn a lot, and that was every morning for about an hour. And then afterwards we'd go and wait for someone to consult infectious disease, which honestly, they don't really consult infectious disease as common as I thought they would. We get like 3 to 4 consults a day, so it wasn't really crazy on infectious disease, but it was some really interesting like infections. I got to see a lot of really cool things that you'll hear about in Sketchy and read about in your books and stuff, and that you don't expect to see, but you do see. So it was super cool. I thought it was really awesome. I don't know, I enjoyed infectious disease a lot. I didn't even know it was a thing before this week, and after that I was like kind of hooked on it. It's something that I am actually considering because I really loved it so much. I like dealing with the infection, and it also is a mystery because you'll have someone come in with fever and possible sepsis, and then it's up to you to find out like what's going on, what caused this and stuff like that. So you are kind of a detective, which is cool. And then what antibiotics to prescribe, which was really cool to learn about like the different types and how you have to think about what you're giving the patients, and how they can like interact with other drugs. And it was really interesting how much thought actually goes into like picking patients' antibiotics and trying to find out what their disease is and stuff. So I really enjoyed it. The infectious disease attendings are some of the nicest people I have ever met in my life. They're literally the happiest, nicest people I've ever met. They were so sweet. They were so kind to us. They loved teaching, and it was really interesting to listen to what they had to teach us. So I really enjoyed this week. I thought it was one of the most interesting weeks I've had so far. And it was cool being able to like kind of do the same thing, go see my patient, ask them their full history, do a physical exam, kind of try to like present something, come up with like an assessment and plan to the best of my ability, tell the attending what I thought, then the attending would be like, oh yeah, you're right, I think the same thing, or no, you're wrong, I think this, and this. So it was really cool to like be able to see what they thought and the thought process that they had to go through. So I saw a lot. I saw patients that possibly had tuberculosis. I saw patients that possibly had fungal diseases. Saw lots of like Pseudomonas, Klebsiella, like really cool things. I even saw like drug-resistant E. coli, and I was like, this is so fascinating, like getting to see all these illnesses in real life. Obviously, it sucks for the patient, and they're not doing very well when they're that sick, but it is cool to be able to see how the attendings can help them by finding out what they have and prescribing the right medication for them. So that was super cool. Definitely enjoyed this week. And so yeah, that was my 2 weeks of internal medicine. For internal medicine, I did watch, I didn't watch any like videos on online med because I didn't find like an internal medicine subject. Internal medicine is basically everything, so you kind of have to know everything. But I did focus on infectious disease because I do have like online med ed on that, so I did watch those videos, which was really helpful for that subject. Overall, I think I am still leaning towards primary care after these past 6 weeks. I was happier on internal medicine. I still think I really want to do outpatient. I don't think inpatient is a lifestyle for me. And so I'm learning a lot about myself and what I like and what I don't like, which has been really cool. But I'm excited to start outpatient and get to go to clinic again next week. That'll be exciting. I have OB-GYN, I have psych, and surgery next week, and it's all outpatient clinics. So I'm looking forward to being outpatient for a little bit. We do have inpatient blocks again throughout the next year and a half or so. So I'll be back on IM, on surgery, and I think psych and family medicine and peds. So I'll be back in the hospital for those specialties. So that'll be good to be able to like see these people that I've become friends with, the residents, the attendings, and able to like grow friendships with them throughout the year. So I hope I get to see them again and work with them because that'll be really cool. But yeah, I hope you guys enjoyed this video and my past 6 weeks on inpatient. I can't believe how like fast it went by and just how crazy it was. It was just so different to be in the hospital every single day and to not be in a classroom. It was just like culture shock for me. So it was really cool though. I did enjoy it and I did learn a lot. So thanks so much for watching, guys, and I'll see you soon. Bye, guys.